Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what bipolar disorder is, DSM-5 criteria, symptoms of mania, symptoms of depression, diagnosis, bipolar disorder and epilepsy, treatment options, and risk. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Bipolar disorder is a mental health condition that includes emotional highs and lows, such as abnormal changes in happiness or depression. These emotional fluctuations can affect sleep, energy, and physical activity. These mood swings may appear rarely or multiple times a year. Bipolar disorder has genetic predispositions. The majority of individuals with bipolar disorder have relatives with those conditions. Lack of sleep, stress, and drugs may trigger bipolar episodes. It is believed that discrepancies in brain chemicals lead to dysregulated brain activity. The average age of onset of bipolar disorder is 25 years old. In order to be diagnosed with bipolar disorder, the DSM-5 states that at least one episode of hypomania or mania must take place. The individual may also experience a depressive episode. Mania is characterized by an irritable and elevated mood and must last at least a week for the majority of days. Hypomania is characterized by the same mood but must last at least 4 consecutive days for the majority of the day. A mood is characterized by 3 or more symptoms characterized by a significant change from an individual's usual behavior. Symptoms of mania are abnormally high self-esteem, decreased need for sleep, over-talking, rapid thoughts, easily distracted, increase in goal-directed activity or psychomotor agitation, engaging in activities that hold the potential for painful consequences. A mood is characterized by 3 or more symptoms characterized by a significant change from the individual's usual behavior. Symptoms of a depressive episode are depressed mood most of the day, loss of interest in activities, significant weight loss or little to no appetite, fatigue, feeling worthless, and diminished ability to concentrate. In order to diagnose bipolar disorder, a doctor performs a physical exam, conducts blood tests, and asks about symptoms to rule out other diseases. If no other diseases are found, then a psychological evaluation is performed to determine if the individual has bipolar disorder or not. A psychological evaluation may include physical exam. A physician performs an exam to identify any medical problems present. Psychiatric assessment. The physician will do an assessment and have the individual fill out a psychological self-assessment or questionnaire. Mood charting. Keeping daily records of mood and sleep patterns. Criteria for bipolar disorder. Compared symptoms in the DSM-5 to see if the symptoms an individual is experiencing meets the criteria for a diagnosis of bipolar disorder. People with mood disorders such as bipolar disorder are more likely to experience seizures. According to the article, Bipolar Disorder and Epilepsy, a Bidirectional Relation, Neurobiological Underpinnings, Current Hypotheses, and Future Research Directions, Biochemical, Structural, and Functional Abnormalities in primarily bipolar disorder could also occur secondary to seizures. The challenges that people with bipolar disorder and epilepsy face is while there is a great deal of focus and information on depression, there is a lack of information on bipolar depression and very little information about mania. According to Mayo Clinic, the following treatment options for bipolar disorder are medication, mood stabilizers, antipsychotics, antidepressants, antidepressant, antipsychotic, and anti-anxiety medications are used. Psychotherapy, interpersonal and social rhythm therapy, establishing a consistent routine for better mood management. Cognitive behavioral therapy helps to identify triggers and learn coping strategies to deal with them. Psychoeducation, educating oneself about bipolar disorder to help understand the condition, get support, and make plans to comply with treatment. Family-focused therapy, family support communication to help individuals stick to and comply with their treatment. One risk factor for having bipolar disorder is having a parent or sibling who has bipolar disorder. Symptoms can emerge during teenage years. The average onset is 25 years of age. People with traumatic events in their past are at higher risk for developing bipolar disorder. Childhood events such as abuse, neglect, or the death of a parent can increase that risk. Highly stressful events such as losing a job or severe lack of sleep can increase the risk of a manic episode. People who have bipolar disorder have a tendency to self-medicate. Substance abuse does not cause bipolar disorder, but it can worsen manic symptoms. Bipolar disorder affects men and women equally, but women are more likely to experience rapid mood episodes, as well as more likely to experience depression and mixed bipolar disorder compared to men. In conclusion, bipolar disorder is a mental health condition that essentially involves highs and lows, characterized by manic and depressive episodes. Some symptoms of bipolar disorder include irritation, elevated mood, as well as lack of motivation or pleasure in activities. Bipolar disorder can be diagnosed through physical examination as well as psychiatric evaluation. Medication and psychotherapy are options to treat bipolar disorder. People with bipolar disorder are more likely to experience epileptic seizures. To learn more about bipolar disorder, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.